How's the baby, Sandra?
You're muted.
He's wonderful. Here, come here, guy.
Aww,
Oh,
so cute.
Except for the sleep deprivation, it's been a complete joy.
yeah. That'll be over when he's 20, maybe 25.
Yeah, I can sleep when I'm dead, right?
Yeah, they just keep you up for different reasons as they get older.
That's what my mom was saying.
Yeah.
And I bet I'm going to be a worrywart with this thing. I can't keep my eyes off of him.
Yeah.
I just came in at the end of that, but I never recognized the anxiety I had in me until I had kids.
Excellent. All right. Oh, hi, Emily. Thanks for joining us. I was expecting Adrian Beck as well. I don't see her.
But yeah, she's planning on joining, so hopefully she'll be on soon.
Excellent. I was hoping that it wasn't me that had dropped the ball on communicating with people.
Nope, she knows.
Awesome. I see Susan Hay Patrick in the participants. I'm going to go ahead and promote her as a
Okay, I think she's just planning on to listen in, but you're welcome to bring her in if you want.
Okay.
Julie, I'm ready with the meeting when you are.
Okay, thank you. Yeah, we can. I don't see Adrian just yet, but we can.
She'll present after Jesse, so I think if we can get started and then she'll chime
Okay.
in.
I will go ahead and dispense with the formalities. And I hope everyone will bear with me because even in all this time that we've been in Zoom, I have not had to chair a committee meeting since we've been here. So could we go ahead and get the screen up for the public participation information? There are many ways to communicate with City Council, even though we are continue to do meetings in the Zoom format. You can register to join any of the webinars at missoulapublicmeetings.com, or you can find our agendas and related documents at ci.missoula.mt.us/webcasts. And then raising your hand for public comment once you are in a meeting. There are multiple options depending on what device you're using. If you're joining on your computer, you can raise your hand and we'll take public comment on agenda items and non-agenda items, and you'll have the opportunity to provide public comment. If you're dialing in on a phone, you can press *9 to raise your hand and press *9 again to lower your hand. You can always call us and leave a voicemail if you're unable to attend one of our meetings at 406-522-6012, or email us at council@ci.missoula.mt.us. All right, so we could go ahead and take that down. Could we get a roll call of participants, city council participants, please?
Starting roll call, Stacy Anderson,
Stacy is absent.
John Contos,
Here.
Mirtha Becerra,
Present.
Heather Harp, Jordan Hess,
Present.
Gwen Jones,
Present.
Julie Merritt,
Present.
Jesse Ramos, Amber Sherrill,
Present.
Sandra Vazika,
Present.
Brian von Lussberg,
Here.
Heidi West, excuse me.
Here.
Thank you.
Thank you. And we do have minutes from our last public safety and health meeting. If anyone has any additions or edits to those minutes, please let me know. Seeing none, those will stand approved. And do we have any public comment on items that are not on our agenda? Okay, seeing none, we will go on to our one agenda item, which is an update on the emergency winter shelter and the non-congregate shelter. And I want to start off by saying thanks to Jesse Jager from the Poverello Center for being in attendance, as well as Adrian Beck from the Office of Emergency Management, and Emily Armstrong, our Director of Reaching Home here at the City of Missoula. And Emily, how about we start with you?
Perfect. Thanks, Julie. Thanks for having all of us here. So I am just here to do the quick introduction. I'm going to hand it over to Jesse and Adrian in a minute. We're just hoping to give just kind of an update. The emergency winter shelter that was managed by the Poverello Center and operated by the POV for our 2020 and 2021 winter just closed on April 30th. So we now have our ability to kind of look back and reflect on that whole process. And so we're just here to give an update on what that looked like this year. Some numbers and yeah, just kind of wrap up the emergency winter shelter for this winter. And then Adrian is here to talk about the non-congregate shelter, which has been a really critical component of the success of our homelessness system and our shelter system during COVID, given that it is a place where folks can quarantine and isolate safely outside of the shelter system when identified as a positive case or a close contact, and has also helped us move some folks into permanent housing. So it's just been a really critical component of the whole landscape of this. And it's, you know, we kind of think you can't talk about one without talking about the other at this point. So Adrian's here to give that update as well. So I will pass it on over to Jesse and you can take the floor.
Great. Thanks so much, Emily. Again, my name is Jesse Jager, he, him pronouns, Director of Development and Advocacy for the Poverello Center. First of all, I just want to say you might have seen our news. We have announced today that Jill Bonney is going to be our new executive director starting July 1st. If you don't know Jill, she's been with the POV for 7 years, most recently as our director of programs. She's fantastic. You're going to love working with her. She's been doing a great job with working with our veterans programs for most of that year time. So just wanted to let you all know that. Just got announced this morning. So yeah, we have wrapped up winter shelter here at Johnson Street. I'm actually still in the building right now in what I affectionately call my shipping container office. But things are getting cleaned up here as we speak. If you drive by, you'll see that there's full dumpsters full of stuff getting cleaned out, and we're kind of wrapping up shop over here right now. Just as a reminder, we started it here this year on November 1st. The reason we were here is because we needed to create more social distance shelter space in our community. We had to cut capacity at the main shelter, and we just needed to get more space and work just really closely with you all, the folks at the city. Just very much appreciate our collaboration in terms of making this possible and working with the folks at the county to make all that possible. We are just the numbers in terms of how many folks we served. We served 509 unique individuals during that about 5 to 6 months period. The minimum number of people we served in the night was 24. The max we served here was 137. So you can see we got pretty close to that 150 number, which was the maximum that we felt we could fit into this building. Averaged throughout the whole winter was about 82 people a night. That number, I think, climbed as the winter moved on, and particularly after we had that really hard cold snap, numbers were pretty big from there on out through the rest of the winter. Just a little over 14,577 nights of stay happened during that time. And I would say that, you know, some of the big accomplishments that I would see happened of that, one was, I think the camps, the outdoor encampments were at their smallest levels that our HOT team has ever seen in the time that HOT's been around. So I think that that's a really big victory. The HOT team did a fantastic job of getting folks into shelter. We also saw a lot of younger folks who we didn't often were able to bring into shelter, come into shelter at the J. Johnson Street facility. One really great success story is we had an individual who was a young person who had aged out of the foster care system into homelessness, had been homeless for a couple of years, had been reluctant to come into the main shelter, but started showing up at the Johnson Street facility. Our HOT team was able to connect that individual with the Human Resources Council's youth outreach team. That person was able to get resources and is now housed. And that just is, I think, just an illustration of the community impact, bringing people together, having folks more access to get people into resources and stuff. So we feel pretty proud about that. And we've got several of those stories of being able to move people into housing because we had better access to them here over the winter period. So we're happy about that. I would say some of the challenges that we did experience through the winter, you know, it took a lot more than we thought to kind of retrofit this basically old warehouse into a place that could be used as a habitable shelter. You know, a lot of work went into that, and we had to invest some dollars into making that happen. And as we think about we're looking forward, we're hoping that at least for another year that this facility might be available in case we are still in a socially distancing protocol moving forward. We're going to continue to be following CDC guidelines around COVID and the need for social distance in the shelters. We've not heard anything about any of those guidances changing anytime soon. We do know that across the sector, the expectation is that vaccine uptake, so people actually getting the vaccine from people who are experiencing homelessness, is going to be lower than the general population. That's going to be for a lot of reasons. Big one is going to be kind of some of that substance abuse, mental health challenges folks experience and less trust of those systems. So we expect that we might need to still be in these kind of socially distancing postures for a little while now, at least into maybe next winter. We are working on our plans with our partners at the city about what that looks like and have some different scenarios that we're mapping out from basically what we did this year all the way to back to Salvation Army and operating like we did last year. So that's kind of the big story, about what's been going on here. The building itself here is cleaned up. All the stuff that was out in the kind of hangout space out in the parking lot area has been cleared out, and we're hoping to have things buttoned up here completely in terms of stuff by the next week or so. Emily, did I miss anything?
Oh, I think you did a great job. Thanks, Jesse.
Great. Yeah, and if you've got any questions, I'm happy to answer.
Let's turn it over to Adrian first and then maybe do questions all at the end.
Mm-hmm.
Sounds good.
Excellent. Thanks, Emily. And I'm Adrian Beck. I'm the director for the Missoula Office of Emergency Management. And I'll give kind of a high-level overview of Non-Congregate Shelter, which many of you have received kind of intermittent briefings throughout the pandemic about our operations there. But for the benefit of this committee, I'll give kind of that high-level overview and then get into some of the numbers. So in March of 2020, when really the pandemic started to impact Missoula County, we were faced immediately with a situation of individuals who were residing in congregate settings, mostly in the POV, being identified as close contacts or is actually testing positive for COVID-19. Obviously, the Poverello Center didn't have the capacity to provide those isolation or quarantine facilities within their facility. And so the Missoula City County Health Department was immediately faced with this challenge of initiating health officers' orders to individuals needing to isolate or quarantine without a suitable location to do that in. And so we started in a very sporadic kind of one-off situation with 35 individuals starting in the month of March all the way up until April, where we needed to find them individual hotel rooms. At this time during the pandemic, most of the hotels in Missoula County were sitting vacant because we were in a state stay-at-home order. However, most hotels are owned by larger corporate organizations who had a corporate policy to not allow, to not knowingly rent any rooms to individuals that were suspect of or actually had COVID-19. So that really limited our options and our ability, and it kept us in this constant state of not being able to plan and kind of having to react. And so amid that situation, we approached City Council, the mayor, and the commissioners to look at if there was any facilities within city or county ownership that we could retrofit for this purpose. Unfortunately, we couldn't find any, and that's how the Sleepy Inn became to be secured by the city. In April, that transaction occurred, and by early May, we were able to start taking individuals into that facility. To date, we have served 283 unique individuals with non-congregate shelter since March of 2020. 35 of those were, as I mentioned, in kind of one-off situations with local hotels. If you will recall, non-congregate shelter was a brand new program that was authorized by FEMA, the Federal Emergency Management Agency, as a local government's legitimate response to the pandemic. And so they quickly pivoted to create guidance around what those protocols and procedures were for local governments to access funding to provide that service. And essentially, there are 3 criteria that individuals need to meet, at least one of them, in order to be eligible to access non-congregate shelter. The first, and these are in priority order, the first is that they have tested positive for COVID-19. The second is that they have been identified as a close contact through contact tracing with the local health jurisdiction. And then third is a category that's a little bit more nebulous in that they meet the eligibility criteria as being considered high risk by the CDC guidance. And that high risk criteria is defined as being over 65 in age and having one of many underlying health conditions that would make them more susceptible to have a negative outcome should they contract COVID-19. And so if you think about it in terms of that third category of folks, these high risk folks, they really were eligible to access non-congregate shelter as a way of self-isolation to prevent them from being exposed to COVID-19. All of those categories have nothing to do with homelessness. However, we acknowledged early on that largely was the demographic we were talking about. 98% of the people that came through non-congregate shelter over the last year and some months have identified as being homeless or were referred through the providers that work with the homeless population. A small percentage, that 2%, were individuals who were traveling through town and did not have the resources necessary to kind of secure their own shelter or quarantine space. So breaking down those numbers, 262 of the individuals who stayed at the Sleepy Inn were in the category 1 as being COVID positive or category 2 as being a close contact. 21 individuals were in that high risk category, and 7 of those, so roughly a third of those, were moved to permanent housing in the time that they were staying at non-congregate shelter. That doesn't happen without dedicated case management. And one of the challenges that we faced with the FEMA guidance around non-congregate shelter is that really it was about being able to provide food, water, and security, so kind of those basic needs. But the wraparound services that we had discovered were so critical as far as being able to provide case management to individuals that were accessing non-congregate shelter was not an eligible expense for FEMA. And so we were able to work with the city and the county health department to access some CBDG funding to hire a dedicated social worker to work for the health department assigned to non-congregate shelter. And that probably is the biggest success of all. I've often said, as looking in the rearview mirror, that non-congregate shelter just does not work without that dedicated social worker position. Not only was she transformative in getting these individuals that were residing at non-congregate shelter tied into all the different services that may be available for them to move on to a better situation, but she was central to getting those 7 individuals housed into permanent housing. I can go through some financial numbers if it's at all of interest to you, or we can wait till questions. But
yeah, why don't you go ahead and give us that information?
Sure. So the way that FEMA reimbursement, the way that FEMA public assistance works in any of these eligible activities in an emergency are that the local jurisdiction, city or the county, makes the expense and then asks for reimbursement. And so over the course of the last year, we've truncated those reimbursement requests into 3-month snapshots. To date, our total costs to date, and this runs to the end of April, are $1,138,810. FEMA has reimbursed Missoula County $929,531 of that total cost. We expect to be made whole when it's all done, but sometimes those reimbursements don't exactly line up. As I think this committee is aware, through an arrangement with the city, the county is paying a lease for the utilization of the Sleepy Inn for our exclusive use of that facility for non-congregate shelter. And to date, the city has been paid $345,683 in lease payments for that facility. Having the facility in our kind of exclusive use and exclusive control is also one of the kind of critical components for non-congregate shelter, and that it allowed us to make planning assumptions as to what our capacity was, what surge needs we may need. And in fact, in November of 2020, we were seeing a routine instance of being at capacity or very near at capacity. And as I think we've all learned through this pandemic, we never quite know what to expect, the next week, the next day. And so that forced us to kind of implement a surge plan that we executed in December. And that surge plan was to take those individuals that were in that high risk category. So they didn't pose any risk of spreading the disease to anyone else. They weren't positive. They weren't a close contact. It allowed us to take those folks that were in that tier 3 category and move them to an alternate facility for a period of time to allow us more capacity to take in what was our highest priority, which was those that were positive and or identified as close contacts. And that's all I have, but I'm happy to answer any questions.
All right. Thank you. Thanks, Adrian and Jesse, for all of that information. I'll go ahead and take some questions from council, and I see Gwen has her hand up, so go ahead.
Hi, just really quick. Adrian, you were talking fast because you had so much to cover there, which was awesome. You always have great information. I just wanted to go back over, I was trying to take notes, the 3 requirements in order to house people. The first one was people had to have tested positive for COVID-19. The third one was eligibility criteria in terms of being high risk. What was number 2 though? I didn't catch that.
Sorry, I probably was talking very fast. I apologize. So the second category was individuals that have been identified as close contact through contact tracing.
Got it. Okay, thanks. And I didn't really have any other questions, but I just wanted to comment that I've sat in a lot of meetings with you for the last year, and Missoula is very lucky to have Adrian and Jesse and Emily and people from the POV. These are hard issues to work on. These are hard issues to begin with, much less during a pandemic. So exponentially more difficult. And thank you, all of you, for your work on all of this.
Yeah, thanks, Gwen. I would second that we have been lucky to have so many great folks and staff at the city and the county, and all of our nonprofit organizations who have been involved in helping keep people safe during this time. So let's see, next I have Heather.
Thanks, Julie. Adrian, great presentation. The work that the team with Jesse as well as Emily have done has just been incredible. And, you know, especially for a portion of our population that oftentimes we hear from folks that don't value them. And so to have actually done something for their benefit, which ultimately protects the rest of us, it's been monumental. And I guess my question to you today, knowing what you know now, if you could go back in time, is there anything in particular that you would do differently?
You know, I continue to be amazed when I look in my rearview mirror at how quickly things unfolded. And so, you know, off the cuff, I would say that we would have secured a facility sooner, because once we did that, everything kind of calmed down. But it's hard to say that because the pace with which we moved was very, very fast. And I think everybody should be applauded for that. I mean, we saw a situation, we found a solution, and we executed it. But I think that the recognition that that we needed not only dedicated staff, but that we needed a dedicated social worker. Once all of that came into place, and that didn't come into place really until probably late May, things really kind of found their stride, and we really came out of crisis management and just got into kind of program management, which is what we really were aiming to do. And so getting there sooner would have been better, but I'm not sure how we could have done that.
And a follow-up, Julie.
Please go ahead.
Can you tell us a little, or share a little bit more about what specifically that social worker did in terms of providing service for those individuals?
So Alicia Healey was hired to work directly for the health department, strictly because we couldn't hire her using our FEMA eligibility funding. But, you know, I probably can't tell you all the crises that she averted. But anytime that we had individuals that were experiencing substance abuse issues, mental health issues, she was able to intervene to get them connected to appropriate resources to ensure their ability to stay at the non-congregate shelter. I think a lion's share of what she did was working with those individuals in that tier 3 category, those high-risk individuals, to ensure that whether or not we could find them permanent housing, that they could be set up for success when eventually they did leave the non-congregate shelter. You know, her work was working with case managers throughout the county, as well as closely working with the hospitals as individuals were being released from the hospital, but maybe still in a situation where they needed to be quarantined or isolated, making sure that they were appropriate fits. You know, we were able to do a lot of things at the non-congregate shelter, but we're not able to provide medical care. And that's a pretty bright line. But at the same time, I think that social worker was able to navigate those systems to figure out how we could still be supportive within the boundaries of what was appropriate, to ensure that not only people's quality of life was good while they were there, but that they could successfully transition into and out of the non-congregate shelter.
Thanks, Adrian.
I'll also add, Alicia works very closely with our coordinated entry system in this work. And so I work very closely with her. She attends a number of meetings. She's at our case conferencing. She's extremely well woven into the system and has been a resource in helping us connect with folks, and just, you know, kind of jumped in quickly and became a wealth of knowledge. So she's definitely been really closely connected to the coordinated entry system throughout all of her work.
Thanks, Emily.
Thanks, guys. Okay, next I have John Contos.
Yes, I missed the figures for reimbursement from the county.
Maybe Adrian, you could give those in a little more round numbers. I got lost when you got
Sure.
down.
Well, I'm sorry, I didn't quite. Do you just want those financial figures again in a slower way? Okay, sorry.
Yeah, that'd be great. Thanks.
You bet. So the county has borne the cost of $1,138,810. And that includes not only the lease payments that we pay to the city for the facility, that includes utilities, that includes our staff that we have working there 24 hours a day. It also includes security that is there 24 hours a day. Of that cost that we have borne to date, FEMA and or the state of Montana has reimbursed the county $929,531. So we're very close there, and that's just a matter of getting our dates aligned. And so we expect to be made whole by the time we get our last submission in for reimbursement. Of that, we have paid $345,683 to the city in lease payments exclusively.
Great. Thank you.
Thanks for repeating those numbers, Adrian. Next, I have Mirta.
Thanks, Julie. I just want to add my gratitude to all of you for all the work that has gone into providing the services that were needed at the time, with the expediency and the compassion that was needed in our community during the pandemic. Oftentimes we say we need to collaborate to work on a difficult issue, and we did it. I feel like this is what collaboration looks like. So now we know how to do it. We know it works. We need to continue to do it. And I think that this will have all of us better prepared to deal with what we know is an issue that we might not have the pandemic before us, but I think that it has highlighted the continued need for shelter, especially during the winter. And so my hope is that all the entities that have been working together will continue to do that, to continue to provide the much needed service and shelter to our unhoused neighbors. So thank you again for all the work that you have been doing and that I know you will continue to do.
Thanks, Mirta. And next I have Brian.
Thanks. Thanks, Adrian, for repeating those numbers. In some respects, they're the least important part of this whole story, but they are important, and it's grateful to hear those details. I can't say it any better than Mirta just said it, and some of my other colleagues. I think inevitably of sort of the arc around winter shelter from a couple years ago, using the transit center, the work with I'm blanking, and I'm embarrassed that I'm blanking. The other
Salvation Army.
Thank you, the Salvation Army, and the coordination there with the POV, and then we started planning for this past winter before winter was over, if I remember correctly, the year before, and eventually landed with the Johnson Street and Poverello Center locations, and there will be a continuing evolution there. So that's a long-winded way of getting to thank you to Jesse and the POV folks, to Adrian and everyone involved with her team. I think I heard you say, Adrian, we saw a situation, we found a solution, and we executed a plan or something like that. And it feels like that belongs on a t-shirt or something important. But that's exactly the right synopsis of the actions. And thank you to Emily and the folks at the city and anyone else I might be forgetting. At the end of the day, I don't know how many lives were saved, but I know it was a non-zero number. And that's what we should all be doing. So thanks.
Thanks, Brian. That is key. We never know really the numbers that we prevented from being in harm's way, but that we know that we did prevent people from suffering. So next I have Amber.
Just playing on that, I remember at the beginning of the pandemic, I heard a public health expert, don't remember who it was, say that in public health, if we do things right, it's not as bad as what we said it could be. And so everyone says we overreacted. And that's always stayed with me. And I think, you know, not knowing exactly what we prevented, but knowing we prevented something is important. Anyway, so Adrian, thank you. And thank you, Jesse. I think this was really interesting and I've been looking forward to getting this update. And it's funny that you say we could have maybe moved faster and it felt really fast when you were sitting on city council, even though it felt like the right direction. So I know you needed that solved and I'm glad that this was a good solution. Do you have, how many, I'm just kind of curious because I know our numbers are looking better and better. I know we're also not done with this. What are our current numbers there? Did you say that and I missed it? And like, do you have some sense of if things keep going in the same direction? Can you predict the future of how long it'll be going on?
If only I had that crystal ball, right? You know, we have seen over the course of the last 16 months a direct correlation with our community numbers and the utilization of non-congregate shelter. And so by that, I mean that when we have a high case count, we tend to see a heavy utilization of the non-congregate shelter. And so where we have been kind of in descending case numbers and doing relatively well here in Missoula, the utilization has been pretty light. We still do have those tier 3 individuals, those that are high risk and over 65 with underlying health conditions. But those that are accessing it for being COVID positive or being identified as close contact is low right now. We are in constant contact with FEMA Region 8, which is our region that approves our activities for public assistance. And they are beginning to ask the questions as to what is our plan as far as when we can transition away from having non-congregate shelter as kind of an open-ended activity. And so Ellen Leahy and the health department and I are continuously looking at that. I think that, you know, in the next probably 3 to 4 weeks, we will be trying to make some decisions about what the future of that looks like. It's not I mean, we always knew that it was a finite solution and that it was a response to the issue at hand. It's not appropriate to keep it open forever. And at some point, you know, our vaccination numbers and our descending case counts will be justification to look at alternatives.
Thanks.
Okay, that's all the hands I see up among the council members. I have a question since we still have a little bit more time here. So we've heard the success stories with the social worker that we were able to hire to help with individuals that were at the non-congregate shelter. And that's very heartening. And we heard some similar numbers out of the temporary safe outdoor space that a number of people were able to transition into permanent housing, which I feel like every time we can do that is just something to be celebrated. I'm wondering two things. Is there something of the tactic that we've taken at the non-congregate shelter that could be applied more directly at the Poverello Center to help with getting more people transitioned into housing? Or maybe before that, I should ask Jesse to speak to the numbers of people in his experience that are able to transition into permanent housing after staying at the POV.
Yeah, so I mean, we're always actively working on trying to get people into permanent housing at the POV. We are the biggest front door to the coordinated entry system, and then work with system-wide folks to get people moved into that permanent housing, and that's often working with partners and stuff. So when you talk about like, Adrian Beck and their team getting people into housing, well, it's likely that our hot team members and some of the other folks were part of that happening. The safe outdoor space, the hot team and members of our team were working with them and are playing a role in helping get those folks into shelter. We were able to get the Cornerstone permanent supportive housing place opened this winter, and that filled up, I think, right away, right, Emily? And a lot of that was with, I think there's 14 units there. Am I right? 12. And that was filled with a mix of people from the safe outdoor space, Poverello Center clients, and folks from the non-congregate shelter setting. And then we have a lot of people that come and go. Like our average length of stay is 40% of the people that we serve stay less than 3 days. And that they're kind of coming in and out in terms of having a little bit of a crisis. It's hard for us to track exactly where they've gone next. In fact, we have working with the city on a whole data system project right now to improve some of those systems. But I do know that our team was involved with I think at least 15 folks getting housed over the winter period. Some of that was engaged in the shelter itself. Some of that was winter shelter, and often we are working with partners that are also collaborating on that. So yes, we're a housing first model. Our goal is to get people into housing. I would say that the biggest challenge we face is that there's no housing. That's just the reality of it. We have dozens of people that we're working with right now that have vouchers in hand, could pay rent tomorrow, but can't get into a place to live. And that's just the reality of where we're at as a community in terms of housing and affordable housing. And that's frankly, we're a Band-Aid until that problem is solved in terms of what's happening. So we're kind of trying to keep people alive until there's enough housing that people can get into.
Thanks, Jesse. That is a really good perspective to understand that there's so many people out there that have vouchers, and if they could find a place that would rent to them, that they would be housed. So that's a wholly separate problem. That Wake just.
Well, also, I'll add. Sorry.
Go ahead.
I was just going to say, I'll add the point that Jesse touched on about length of time is really central to that conversation. The successes of Alicia working with those tier 3 individuals and the TSOS caseworkers is largely that they have ongoing multi-day, multi-week connections with these folks and can really build those relationships and move through the whole process with them together with one caseworker, one social worker the whole time. And that is a really successful way to make that process happen. So the challenge of doing that same thing at a shelter is pretty significant because it is just a more short-term fluid space. That's an important piece.
And I do believe one of the people that we've got housed through the, I'm not going to name names here, but there was a person that was at the POV for many years who the only reason this person was an older individual, at-risk stuff, was a pillar of our resident volunteer program. This person had a felony from 30 years ago, had plenty of income to pay rent. But because this person had a felony from 30 years ago, could not get into housing. And I've got dozens of those stories. And I think this person finally was able to get into housing through that tier 3 system, and is one of those successes. And I just want to say one thing about the non-congregate setting. The death count for COVID amongst the homeless population in Missoula would have been significantly higher if that place did not exist. We worked very closely with Alicia and that team to get people out of the POV shelter and into non-congregate setting. And the reason we didn't have the kind of COVID spread within our facility is 100% by that. I'm convinced we saved, hundreds of lives. Because of that. There are some communities that saw 70 to 80% COVID positive rates within their shelters, and we never even got close to anything like that in Missoula. So we absolutely saved people's lives because of the Sleepy Inn and that project.
Thanks, Jesse. I appreciate that. I've got one more question about the social worker that you were able to hire with the CDBG money. How long is that? Do we currently have funds to keep that person employed? And what's the plan for that position once that grant money is expended?
So the grant money that Alicia's position with CBDG funding expires at the end of June. The health department is committed to bringing on a temporary position under their COVID response should we have a need for that position to continue. And all of that is contingent upon, how long the non-congregate shelter is going to remain in operation.
Thanks. Mirta.
I just wanted to, ask, but also point out that on May 11th, there's a Reaching Home Missoula 10-year plan to end homelessness annual update. And I'm wondering if the information that you guys have given us today will be part of that. Just wondering how people in the community can get access to this really important information.
Yeah, thanks for asking that, Mirta. I am in the process of creating that presentation and having a very large struggle trying to fit all of this information into the very short period of time that I have to present, because the large majority of that update will be a panel from providers and representatives from the homelessness and housing community. So some of this will be there in brief terms. I won't be able to dig deeply into all of it. There's just too much information for the short period of time. But these many of the statistics we talked about today and the kind of highlights of the stories were in a press release that went out today, and they'll be touched on during that presentation. And that presentation will also be, I believe, streamed on MCAT, so available to the public afterwards and during.
Great, thanks, Emily.
Thanks.
Yeah, thank you for that reminder, Mirta. So put May 11th on your calendar if you haven't already. Any other questions from City Council? Seeing none, do we have any comments, public comment? Susan, I think that you're our member of the public. Would you like to add anything before we call it a day here?
I just wanted to, Emily and I meet weekly and talk about reaching home and challenges and solutions and brainstorming. And when she told me about this meeting, I just wanted to weigh in, because obviously one of the components of our continuum of care that we're missing is what happens to the people who are in the Johnson Street shelter who aren't able to go back to the POV yet. And it just underscores we need to have more options for people experiencing homelessness. And, those of us who work on these issues, and I certainly am not on the front lines, we devote a lot of time and thought to this, and are grateful to those of you who join us in knowing that we need all hands on deck, the public sector, the private sector, to figure out solutions that get us toward our goal of making homelessness rare, brief, and non-recurring. So we've got the TSOS, we have the Poverello Center, we're working hard to get people into housing, but we're certainly not there yet. But I'm really grateful to you all.
Thanks, Susan. And I would just add that discussions have already started for planning for winter shelter for next year. There are some moving pieces with that we will hopefully be nailing down so they stop moving in the very near future. But those discussions are already happening. So that it's, as I think someone alluded to earlier, the collaboration among all the different entities is really important. All right, anyone have anything else to add? Well, thank you all for your time, and we can I think this is our last meeting of the day, so everyone can go enjoy their afternoon. Thanks, folks.